good people, Dr. Tung'ani again. Let's talk about a thorny problem called infertility. Various experts have agreed to define infertility as the inability of a couple to conceive after a full year of exposure to regular sexual intercourse. There are exceptions to these, but for purposes of this discussion, we'll stick to this definition. Now, for fertility, it takes two to tango, so to speak. That is, for conception to happen, a healthy sperm from the man has to meet a healthy egg from the woman. Hence, conditions that affect the man cause male infertility, and those that affect the woman cause female infertility. So what causes infertility in a man? In a healthy man, sperms are formed and stored in the testicles through a series of biochemical steps. The signal initiating these steps starts from the brain. The sperms have then to travel through a series of tubes and leave the penis through ejaculation to reach the female reproductive tract. So take note of the processes of a brain signal to the testis, formation and storage of sperm in the testis, and ejaculation through a series of tubes. Any condition affecting these processes adversely can cause male infertility, and these include disorders of the testicles, blockage of sperm passages, impotence or problems with ejaculation, or other general or systemic diseases. Special mentions among these include infections like mumps, or even sexually transmitted infections, medical diseases like diabetes, obesity, and thyroid disease, drugs of abuse, exposure of the testicles to high temperatures, and the birth defect of undescended testes. Now, what causes female infertility? For conception to occur normally, a healthy female egg, also called an ovum, has to live and be formed in the woman's ovary after meticulous signaling from the brain. The ova has to leave the ovary through a process called ovulation. It has to be picked up by a patent fallopian tube, inside which the egg meets the sperm and fertilization occurs. The conceptus then travels through the tube to the uterine cavity where it attaches. Female infertility can hence result from lack of ovulation, which can be caused by a wide variety of conditions, blocked tubes, mainly from infections, abnormalities in the shape of the uterus, which can be because of tumors or any other congenital or birth defects, among many others. Now, to find the cause of infertility, tests can be done for both the man and the woman. For the man, the tests that can be done include analysis of his semen, an assay of the reproductive hormones, imaging of the testes and or the brain, among other tests. For the woman, imaging of the uterus, the ovaries, and the tubes can be done. It can be done either by ultrasound or a special X-ray called a HSG, hysterosalpingogram. An assessment of her reproductive hormones can also be done, or in cases of blocked tubes, minimally invasive surgical exploration can be done, either for the tubes or for the uterus. How is infertility treated? Now, first-line treatment for infertility includes living healthy, that is, healthy diet, regular exercise, stopping of harmful practices like drug abuse, avoiding tight underwear for men, and of course, regular sexual intercourse. Specific treatment for infertility will of course depend on the condition, but may include the lifestyle changes already mentioned, treatment of any underlying medical conditions or infections. Now specifically for the man, hormonal therapy can be done. Treatment for intercourse problems like impotence or premature ejaculation can be initiated, and surgery for blocked sperm tubes. For the woman, treatments may include stimulation of ovulation, surgery for blocked tubes or uterine anomalies, and if all this does not work, assisted reproductive techniques like intrauterine insemination or in vitro fertilization can be done. These are of course very technical and quite expensive, but they do work. Thank you very much for listening.